Hi to everyone. Today we will start with the anatomy of thorax by me, Dr. Rand Abdel Latif. They are about 9 lectures. What are the objectives of our lecture? First, to identify the bones of the thoracic cage. Second, to identify the sternal angle. To understand the thorax, we will divide it into two parts: thoracic wall and thoracic cavity. First, we will start with the thoracic wall. The thorax is the region of the body between the neck and the abdomen. It is flattened in front and behind, but at the sides it is rounded. So the framework of the walls of the thorax is named as thoracic cage. The thoracic cage is formed posteriorly by the vertebral column, ribs and intercostal spaces on either sides, anteriorly the sternum and costal cartilage. Superiorly, the thorax communicates with the neck. Inferiorly, it's separated from the abdomen by the diaphragm. So, thoracic cage, it protects the vital organs in the chest, like the lung, heart, and also it provides attachment for the muscles of the thorax, muscles of the upper limb, abdomen, and even the back. So, the cavity of the thorax, to understand the cavity of the thorax, we will divide it into median partition called the mediastinum, and we will talk about this later. So median partition is the mediastinum, and on the sides the two pleurae and lungs. The lungs are covered by thin pleura, is named as visceral pleura, and the parietal pleura, which line the endothoracic fascia. Between the visceral pleura and parietal pleura, there is a pleural cavity filled with pleural fluid, and we will talk about this also later. What is the structure of the thoracic wall? It is covered on the outside by skin, muscles, attaching the shoulder girdle to the trunk. It is lined by parietal pleura, right? يعني هو الثوراسيك wall lined by endothoracic fascia وبعدين راح تجي عليها الباريتال pleura. The thoracic wall is formed posteriorly by the thoracic part of the vertebral column, as we said, anteriorly by the sternum and costal cartilage, laterally by the ribs and intercostal spaces. Superiorly, there is the suprapleural membrane. Inferiorly, there is the diaphragm to separate the abdominal cavity from the thoracic cavity. So first, we will talk about the sternum. The sternum, it lies in the midline. It is in the midline of the anterior chest wall. It is a flat bone. It can be divided into three parts. First is the Manuberium Sterny, second is the body of the sternum, and third is the xiphoid process. The first part is the Manuberium Sterny. This is the upper part of the sternum. It is the first part of the sternum. It articulates with the body of the sternum at Manuberiosternal joint. The Manuberium communicates with the sternum through Manuberiosternal joint. Also, it articulates with the clavicles and with the first costal cartilage and with the upper half of the second costal cartilage. So all these are the articulation of the Manuberium Sterny. Second part is the body of the sternum. It articulates above with the manuberium, as we said, at the Manuberiosternal joint. Below, with the xiphoid process at xiphisternal joint. So, on each side, it articulates the body of the sternum, articulate من السكند half of the, من اللور half of the second costal cartilage to the seventh costal cartilage. All of these costal cartilages has articulation with the body of the sternum. The xiphoid process is the thin plate of the cartilage. It becomes ossified at the proximal end in the adulthood. It has actually no attachment to ribs or costal cartilage, but later it gives origin to muscles in the abdomen. Sternal angle, or it is named as angle of Lewis. It is formed by articulation of the Manuberium Sterny with the body of the sternum. It can be recognized by a presence of a transverse ridge on the anterior aspect of the sternum. The transverse ridge is at the level of second costal cartilage. So, this point from which all other costal cartilages and ribs are counted. So this is clinically very important, because you will count the ribs if you know the exact location and surface anatomy of the sternal angle. So it lies at the level of the second costal cartilage, opposite to T4, T5. So what about the ribs? As you know, there are 12 pairs of ribs, all of which are attached posteriorly to the thoracic vertebra. All 12 ribs are attached posteriorly to the thoracic vertebra and vertebral column, of course. To understand the ribs, they will be divided into three categories. First are the true ribs. Second, false ribs. Third is the floating ribs. It's very easy. True ribs, it means those upper 7 ribs that attached anteriorly to the sternum by their costal cartilage. So the true ribs are the upper 7 pairs of ribs attached anteriorly to the sternum anteriorly and directly. They attach to the sternum directly by their costal cartilage. The false ribs, it means the 8th, 9th, and the 10th pairs of ribs. They attached anteriorly to each other and to the 7th rib by their costal cartilage. Right? So not directly like the true ribs. The floating ribs, the third part is the third category, floating ribs. They are the 11th and the 12th pairs of rib. They have no anterior attachment at all, as you see. No anterior attachment, only they attached posteriorly to the vertebral column. What is the typical rib? This is the typical rib. It is long, twisted, flat bone. It has a rounded, smooth superior border and sharp, thin inferior border. And you will see this in a practical lab. The inferior border forming, it overhangs and form costal groove. There is a costal groove which carry the costal vessels and nerve. The anterior end of each rib is attached to the corresponding costal cartilage, of course, as you know. The rib has many parts: head, neck, tubercle, shaft, and angle. The head, it has 2 facets. This is the typical rib. It has 2 facets for articulation with the numerically corresponding vertebral body and that of the vertebra immediately above. The neck is the constricted portion between the head and the tubercle. The tubercle is the prominence on the outer surface of the rib at the junction of the neck with the shaft. It has articulation with the transversal process of the numerically corresponding vertebra. Then the shaft, it is thin, flattened, and twisted on its long axis. The inferior border has the costal groove. This is in a true rib. The angle is the region where the shaft of the rib bends sharply forward. So this is the angle. Also, this is a typical rib showing head, neck, tubercle, angle, shaft of typical rib. This is the blue one, is the costal cartilage, as you see, which is anterior, while the head of the rib is posterior. What about the atypical ribs? Atypical ribs, the first rib is atypical rib, and it is very important because it has important relation to the brachial plexus and to the subclavian artery and subclavian vein, and we will see. So atypical rib, the first rib, it is short, as you see in this picture. It is short, it is acutely curved. It has superior and inferior surfaces instead of medial and lateral surfaces, as we said. The head has single facet only 41, single facet. It has, as we said, attachment to the scalenus anterior muscle. Anterior to attachment to scalenus anterior muscle, there is a groove for subclavian vein, and posterior to it, there is a groove for subclavian artery. And in the first rib, there is no costal groove. The second rib is midway between the typical and atypical rib. It is midway between typical and atypical. The others, the 10th rib, as you know, the 10th, 11th, 12th, all are atypical ribs. The 10th has single facet on the head. The 11th has also single facet, and it is with poorly defined angle. The 12th also, it is a small and just thin piece of bone, lacking most of the costal features as other ribs. What about the vertebra? The typical vertebra, I mean in the thoracic region, it consists of rounded body anteriorly and vertebral arch posteriorly. So it consists of body and arch. Between the body and arch, there is vertebral foramen. The body in the vertebra of the thoracic region is heart shape, and it is anterior. It is heart shaped and it is arterially located, while the arch is posteriorly located. طبعا in between the vertebral foramen that carries the spinal cord and its coverings. So there are, the vertebral arch gives 7 processes. It gives rise to 7 processes. 1 is spinous process, 2 transverse processes, with 4 articular processes. هاي ال 4 articular processes are vertically arranged. 2 superior and 2 inferior processes. So all of them, they will be 7 processes. 2 transverse و4 راح يكونون articular processes يكونوا vertically arranged. 2 superior و 2 inferior. والspinous process إذا نيجي نوصفه, it is long and it inclined downward. It is long, inclined downward. This is in the thoracic vertebra. What is the thoracic outlet? If we want to talk about the thoracic outlet, it is narrow aperture. It communicates the chest cavity with the root of the neck. It is called outlet. Why it is called outlet? ليش ما inlet? Because the trachea, the esophagus, the great and important vessels, the great vessels, nerves, they emerge from the thorax to enter the neck and upper limb. Through this outlet. So that's why we call it outlet, not inlet, because they emerge from the thorax to enter to the neck. So this outlet is closed by dense facial layer. It's named as suprapleural membrane. What is the suprapleural membrane? The opening is attached at its apex at the tip of the C7, tip of a transverse process of C7. This is at its apex. Laterally, medial borders of the first rib with their costal cartilage. Anteriorly, superior border of the Manuberium Sterny. It is obliquely placed. It is obliquely placed. It protects the underlying cervical pleura. It resists the changes in the intrathoracic pressure occurring during respiratory movement. Thoracic cavity communicate with the abdomen through large opening, named it is bounded posteriorly by the T12, laterally by the curving costal margin, anteriorly by the xiphisternal joint. Through this large opening, which is closed by the diaphragm, passes the esophagus and many great vessels, nerves. All of them, they will pierce the diaphragm here. So here, this is the chest cavity separated from the abdominal cavity by the diaphragm. And thank you for today.